Out of the growing measles outbreak in West Texas. As of today, up to 158 cases, most of them children. At least 18 are in the hospital. Health officials in the Lubbock area are expanding capacity at the labs down there to try and do more testing. They're also preparing what they're calling strike teams to provide vaccines to people in those affected areas.
And Tom Duzinski is a public health expert with Indiana University. He joins us now. Thank you so much for being here. Can you tell us how concerned we should be here in Indiana? Because obviously a lot of people are watching the national news, holding on.
Right. So in Indiana right now, we don't have any known cases here in the state. However, there are cases from coast to coast, from Texas to Alaska, California to Rhode Island. So there are a lot of cases in like 10 states now in the U.S.
Most of these cases from West Texas are among the unvaccinated. Is that right? Is that what we're hearing?
Correct.
There was a study from the Kaiser Family Foundation a few months ago. 39 states had measles, mumps, rubella vaccination rates below the target rate of 95% for the last school year. 14 of those states reported rates below 90%. Can you talk to us about this 95% rate, herd mentality, how that works?
Yeah, so the idea here is what we want to do is get enough people vaccinated in the population to protect those that can't be vaccinated, like the very, very young, those less than 12 months of age, or those that are allergic to a component in the vaccine. So if we have enough people vaccinated, the virus really can't get into the population then. So that's why we want to say, well, 95% of the population is vaccinated. The virus is less likely to affect those that can't be vaccinated.
Do you think that there needs to be a more organized public relations push among community health departments to try and bring those numbers up? You were telling us during the commercial break, Indiana's average, I think, is what, 85%? About
85, 86%, yeah. I think that, anything we could do to get vaccines into people is the right way to go, right? The vaccines have been safe, they're effective, they've been around since the 1960s in the US. So it's just a matter of how can we get more people to get the vaccine at the appropriate times.
And what messaging do you think should go to people who could be on the fence of whether or not they should be getting a vaccine? I think we all probably know people who are on both sides of the fence.
Yeah, I think the message here is this is a dangerous viral infection that's easily spread from person to person. It's more dangerous than like chickenpox we hear a lot about still, right? And can have severe consequences, especially in the very young children, those under age 5, and we saw unfortunately a death already.
Because this vaccine has been around for 5-6 decades?
Yeah, since
maybe
the 1960s.
Longer? Okay, 5-6 decades.
Yeah.
And so it's proven to be effective.
Very
and
effective.
Widely safe.
Absolutely. Maybe it's 95% effective with just a single dose and up to 99% effective if you get both doses.
All right. Well, thank you, Tom Duzinski with IU Fairbanks School of Public Health, for being here, explaining what's going on and all the information we need to stay safe and healthy. Appreciate it, sir.
Thank you for the opportunity.